Good afternoon. Welcome to today's press briefing. Today, the North Dakota Department of Health confirmed 17 additional cases of the novel coronavirus disease, or COVID-19, putting us at a total now of 126 cases. This is our second highest day with 17 new cases. We continue to have good, positive progress on testing 384 individuals since yesterday, and there have been some questions about how we're doing versus other states. These numbers are fluid because people report testing at different times of the day, but North Dakota remains in the top 10 of states on testing per capita, and our intention is to stay in there and keep moving our way up that chart, because we know that testing and more broad testing is one of the ways that we work our way not only through the crisis, but out the backside as well, in terms of helping us get back to the new normal after this. There have also been some questions related to testing by counties, and one of the things that is come up on that is there's been a concern about how we're doing testing around the state. As you can see, we do have tests completed again in all but 2 counties, and we've done a lot of work up in McKenzie County and Williams County, up in that area, and we'll provide going forward some data on testing per capita. But while these may seem weighted to the metro areas on a tests per 1,000 people, these are actually it's probably quite evenly distributed across the state. I think the main curve that we want to show on the slide, which shows that our cumulative tests going back up, the key point on this is that the curve is still going up. I mean, this is the message every day, which is that we are, some people might ask, when it's going to be over, and we'll know more about when it's going to be over when we know we've reached the top and we're starting to go down the other side. But for right now, as was predicted, we're continuing to see this grow. And again, the key messages here is that on the testing, there's a lot of focus on the testing and the focus on tests by county. But for everybody listening, again, we have to assume 2 things. One is that this data reflects people that got sick at least 10 days ago and are now testing positive now. And it also reflects that we're not catching everybody that is that has the coronavirus, because some people do experience milder symptoms. And when you experience milder symptoms, you may be doing okay, but you can still be contagious. You can still give it to other people. And so again, we know that this may represent only 1 in 10 people that have it. So we should be thinking about the fact that there could be over 1,200 people in the state of North Dakota that had it 10 days ago, and that number is climbing. And so again, this is all very lagging data that when we're looking at the positives. And if you're want to get a view of what some of the futures are, you can go to other states and take a look at the day when they got to 100, and then take a look at the day when they got to 1,000, and you can see when those curves were climbing how fast some of this spread. Now in North Dakota, because we were proactive in putting in a number of guidance about physical distancing, then in that case, then we, maybe you've got a chance to have a flatter curve than some other states. We're certainly working hard to make sure that we don't end up like Italy or someplace else. So we want to make sure, again, our goal is to flatten that.